I am very pleased to be presenting this video abstract of our research titled Content Validation of an Algorithm for the Assessment, Management, and Monitoring of Drug-Induced QTc Prolongation in the Psychiatric Population. QTc prolongation can lead to serious complications, making it a concern for all clinicians. Assessing the risk of QTc, especially in the psychiatric population, which most of their medications causes the side effect, can present a challenge for pharmacists and often results in cardiology referrals, thus delaying treatment decisions. As a result, and based on an extensive literature review, an algorithm was developed for the assessment, monitoring, and management of drug-induced QTc prolongation in the psychiatric population. Therefore, our objective was to validate the content of this algorithm. For our methodology, we have used purposive sampling to select cardiologists to conduct semi-structured interviews with, for the purpose of gathering information regarding their approach in assessing the risk of drug-induced QTc prolongation. Following the interviews, participants were provided with a copy of the QTc prolongation algorithm, along with a brief orientation that was made using Articulate 360 that describes the steps that the algorithm entails to assess the risk of the QTc prolongation. Participants were then requested to complete an online anonymous survey that included quantitative and qualitative components. Moving on to the results. 4 main themes were generated from the semi-structured interviews, along with some themes underneath each theme, as you can see here in this picture. One of these themes indicated that there is a lack of a unified protocol when assessing for QTc prolongation, and this supports the need for an algorithm that includes a verified risk scoring tool when assessing this risk. Moving on to the post-orientation survey, results from the open-ended questions showed that cardiologists supported the implementation of the algorithm and its use by pharmacists. However, they recommended simplification of the steps as they appear to be cumbersome. While the quantitative result, it showed high mean score for the appropriateness of the algorithm steps, the safety and reliability of the references used. An additional analysis using modified kappa and ICVI indicated high validity of content and high degree of agreement between raters. In conclusion, the results demonstrate that the implementation of the algorithm after minor alteration can prove to be useful as a tool for the risk assessment of QTc prolongation in this population. This brings us to the end of our video abstract. Thank you very much for listening.